recommended to me on this email Asperger list on INLV with Martin Becker called Potatoes, Not Prozac. Go get it from the library, it's really good. And it talks about how potatoes have this something, I'm a JP, I don't know what it is, but tryptophan, and eating a baked potato will help whatever, and I feel that eating foods which will help is much better with the mood. And swimming is good, walking is good, but I think medication is bad unless you absolutely need it.
Very individual.
Yeah, like if you have diabetes, fine. Type 1, you need insulin, fine. If you have a certain specific medication like cancer, fine. But in the whole, most of the time, you don't need the medication. Like in the hospital, they give you like 3 Tylenol pills, and it's like you only need 1, and they give you way too much medication when you're especially after surgery, and they end up not wanting anymore. And I kind of have an allergic reaction to the NSAIDs, which means no Advil, no, I can't take any of that. So Christmas Day, my legs were like this. I could barely walk, and yeah, my lymphedema pressure had to come in. And once I was taking off the medication, my legs went way down.
I think that's generally with medication. You always have the side effects, and everybody's so individual with that.
And leaving the hospital, the nurse is going to stick me with another blood thinner as it's being discharged. It's like, thank you very much, but I don't want any more medication, doctor. But I don't want to be stuck with a needle with blood thinner medication and then leaving the hospital to be discharged.
So better the needle with your needlework than the needle. Right? That's great. I think that's a great point too, is to start yourself relaxing, look after yourself is the best way to start with the mental health, is find your needlework or your exercise or walking in the woods. Or I like listening to loud 80s music because I know all the words and I can dance by myself, and I'm not a yoga person, but I can sing to myself, and that's just but I think it's a good point, Tara, is find something that you really love to do. And lots of times for your community, you're so artistic and talented that they should really actually have just a fair for people that, this is what you do in your spare time. And
They do what's called seminar every year, and it costs a bundle of money to go. And I'm not proficient enough to do the EAC seminars. They're like, my needlework isn't all, you have to be really proficient in stitching. And it's like hundreds of dollars to actually go. So they do have this, and they have needlework things and all that.
thank you.
So we have time for one last question before our break.
Yeah, just about schools as they progress towards more autism, not only awareness but capability to treat that condition with good intervention from K to 12. Might we see, as that is introduced, less of more acceptance of the mental health conditions, in other words, using the autism reduction in its stigma as a mechanism to try to reduce that stigma within mental health, and thereby gaining a foothold for treatment for those conditions within an autistic child. Does the panel see that this might be a doorway to reduce that stigmatism and increase the resources available for that?
Yeah, so I'm not sure if, did you say that the power to see that? Is that what you were asking?
Well, I'm wondering if the powers be that the Ministry of Education and CFD, do they see that? Are they looking to improve our mental health on the back of autism, for example?
I don't know about any ministry particularly being, or any power being overly responsive in that direction at this point. But we do see this growing trend, awareness of mental health, the whole being, the whole family, all those things being critical to the health of our society. You now see $20 billion lost in revenue because of mental health days taken off, yada, yada, yada. So there's this growing awareness. awareness, let's talk. Bell Canada's Let's Talk Day. All those things are creating this reduction of the stigma and saying that mental health is the same as physical health. We don't, we're responding to diabetes, we're responding to obesity issues and all those sorts of things, saying we're just not attuned to ourselves as we should, as close as we should be. But it isn't just a physical health thing, it's a mental health thing, it's a social thing that's going on. So I don't think it has to come from the top down. I think it has to come from all of us and say enough's enough. I should not be held out of my school. I belong in that school. That's where my child belongs. And who knows my child better than me? You know your child better than you. So when you're able to take anybody else, when you're able to take that to the school and say, I need help in order to raise this child and develop this child in a safe manner, the school needs the only requirement is a paradigm shift. We're no longer a school that is dealing with the academics. We're dealing with the development of the whole child. Academics is one of those pieces. We now have social, emotional, physical development in our curriculum. They're identified that way. Are they weighted evenly, or are the schools taking the lead and saying, you know what, I have a 16-year-old grandson who doesn't want to go to school anymore for a whole variety of reasons, probably many of which are lying beneath the surface here. And when I went to talk to them as a grandparent, I said, I don't really care whether he graduates at this point with a dogwood or not a dogwood, but I want him to feel like he belongs in this school, that he's safe, that he's welcome not only in this school but in his community. Who can we connect with? And then that took the shackles off, and I said, oh good, you don't care what we do with him? I care. It's not that I don't care. I want him to do well because it is a measurement of our success in our society. But it's not my priority at this moment until he feels emotionally safe in his family, in his community, in his school. Not going to work. So I don't think, when I go to talk to schools, the first thing I say is, we're not laying another curriculum on you. We're just asking you to look at it differently. And it'll make your job easier. As soon as you stop allowing yourself to be reactive to everything else that's going on, and instead become proactive. The last 5 years as an administrator were the best 5 years of my career, because I had stopped trying to be controlling and said, let's help, let's work together on this. It's not a big shift.
Can I just take that a little bit further? Again, parent perspective here. It's a little shift, but it's like just moving a mountain, like, a centimeter or a millimeter. That's what we're up against here. Yeah, no tunnels, nothing, not even a shovel, nothing, other than parents' will. I happen to live in the Surrey School District, and they are the only district that I'm aware of that has the ABA support worker program. Now, I'm not saying that this is the panacea for everybody and everyone should be doing it, and it is a choice available for those of us families who are doing ABA in the homes. The Surrey District, because parents got in there and started advocating, it took years, the Surrey District developed this program where a trained aide in ABA works one-on-one, bell-to-bell with my son, and he is able to thrive in the school setting. And if he were to have, say, an EA who had no training in ABA and didn't know how to carry out his behavior management programs and his academic programs and whatnot, I think the best that we could be hoping for would be that he'd be babysat in school, not kicking up a fuss, not disturbing other kids. But because of this program that they have developed in Surrey, and has been going on for about 6 or 7 years now, he thrives in school. He can read and write now. He didn't go in reading and writing in school. He can read and write now. This is a child who never spoke. So there are ideas out there that are proving that they work for our kids, but we don't have buy-in from most school districts. We don't have buy-in yet from Minister Fassbender, even though our group has met with him a couple of times to talk about this. So there still is a huge shift to go. The other thing about the school system is they have our kids for 13 years, maybe a little bit more, but we need something long before they are 5 years old going into school. And after, of course, because they're just gonna spend most of their time with adults.
Which is the transitions when you're talking about, and that's gonna be a fascinating one, because it is the transitions where we hit the stumbling blocks. It's where there isn't a gathering point of the strategies and the purposeful and intentional practices that have taken place for the child and for the family. It's almost like, oh, you're 18 now, I guess that means you can do whatever. We know that's not true. And it's where we're really kind of hitting the brick wall. But now at least the walls are identified, and the mountain is identified. And I think collectively our energies can take action. A paradigm should not change overnight, otherwise it's not a paradigm. But now we are beginning to say that it does have to become a different paradigm than what we've been using for the last 50 plus years.
Okay, so let's take a break, because I think everyone's probably thirsty. And then we'll come back, we'll have a half hour.
So there's snacks, coffee, tea, water, and some snacks, the newsletter behind